Good afternoon. This is Friday, July the 31st, and this is Anne channel. And today we're going to be having the first video on epidemiology. And afterwards, please take a look at the other video, which is going to be on clinical. There's a lot of information this week, and it's really important that you see them. So let's talk about the virus spread across the world. One of the things we talked about is to really change the American culture that's being very individualistic right now, to try to have a sense of personal responsibility. So people do wear the mask and do the social distancing, may not be for themselves if they don't want to, but for their friends, their family, to allow people in small services businesses to reopen, like restaurants and bars, to allow the school to reopen, which to allow 2/3 of the parents who are dual parents to be able to go back to work, and therefore ultimately improve the economy. So what's happening in the world? In the first video, we're going to focus on what looks like a plateau, but we have to make sure the data is reliable. So we'll talk a bit about that. You can see that India is straight up and it's on its way to pass Brazil. So unfortunately, we have a problem with India. And we're also going to talk that there's a second wave that's happening in Europe. It's not a big wave, but in Spain in particular, there's some issues there. The US, unfortunately, now has passed a daily record of around 1,000 patients per day. In the second video, please take a look at it. There's a lot of new information on T-cell immunity, some issues about kids being contagious, the long-term haulers there, which is showing long-term damage from mild to severe cases there. And we review the treatment that are working. So in the world, we now we're passing 2 million new cases per week. I mean, I just look at the data from last week for this video there, and we have added 2 million cases. And so it's clearly still accelerating on a worldwide basis. And you can really see in the curve in the positive case that it's going straight up, unfortunately. And let's take a bit of a deeper dive. You can see Brazil, is at 2 million, but India is going to pass them very shortly. And on their daily cases, it's currently passing a couple of days ago. On a daily basis, the US is averaging around 70,000, 68, 79, 70,000. We went as high as 77,000. Brazil, it seems to have a plateau, but the data is all over the place. So we have to see how reliable the data is. You can see this huge swing. And India is straight up. And as I said, it passed Brazil a few days ago, but next week, it's clearly going to be number 2 in the number of daily cases. And then we have South Africa that just emerged at 11,000 cases per day. And that's a lot for the size of that country there. And Mexico and Peru seems to have, they're not accelerating. They still have a lot of cases, but they're not accelerating. So on a worldwide basis, straight up, you can see an increase in mortality, which makes sense because there's an average of 3 to 4 weeks delay from the increase in cases to mortality. Quick world dashboard to do like an averaging over 7 days so we can smooth some of this data problem there. The US is around 65,000 cases if you do a 7-day average. India, if you look at that, is now number 2, has passed Brazil. And you can see from the curve, it's still a very straight curve. Brazil, there's a lot of data moving all over the places, so we have to see if there's some quality issue of data or if there is a plateau going on. And South Africa had that spike and looks like there's an improvement there. But if you look at the number of cases per million, we are talking at Brazil at 272 cases per million, which is significantly higher than the US. And then, of course, the high numbers is South Africa, Peru, and Chile. The world cases on the 2 weeks growth, we see a little bit of a lower amount of growth in the Middle East, which was very hot, if you remember, a couple of weeks ago. Unfortunately, US's Brazil are still growing very fast. They're the dark red color, and still problem as we saw with Chile and Peru. If you look at testing, the United States is really not doing that great in the amount of tests per 1,000. In fact, Russia is doing 5 times more tests per person in the country than the US. And so this is really handicapping us. And when you talk to the Quest and the LabCorp, they say it takes 7 to 14 days right now for people to get the results, which kind of takes away all the reason about why you should do the testing, because after 5 to 7 days, you know if you have the cytokine storm or if you don't. So we have a huge problem on the testing side, and we haven't got our act together there. So big problem there. We are the level of Iran and in country like Poland, that's not great. You look at the mortality rate, and again, if you normalize over 7 days, to kind of smooth the data issue there, US is clearly number one, averaging over 1,000 deaths per day for the last 7 weeks. 7 days, and that's unfortunately, if you look at the mortality per million there, we are not doing well at all. We are at the level of 459 per million compared to Peru, for example, which is very high at 576. But it's not a great situation there. Look at comparing to Russia, for example. Fatality rate overall, and we'll talk about that a little bit later on, is that we're learning how to treat patients better, and we'll do a deep dive in the second video. What are the things we have learned and how we've been able to decrease the mortality by roughly half in the ICU. Overall, if you look at confirmed cases and confirmed death, the mortality rate now has dropped to around 3.4%, and the US is kind of right in that same zone. Still remember, Italy was at 14%, and Spain, and we'll talk more about that, Spain is at 10%, and Spain is having a second spike, so we'll have to keep an eye on that. So Brazil, the data is spiking. You can see it's kind of zigzag there, but if you average the curve, it's still on the way up. And you look at the US, and there's some concerns there because the US was on a straight growth and suddenly plateau, and that was just around the time when they changed the way they did data reporting. So we'll talk a bit more about that. Mexico is slowing down. It's still a bit of a growth there, but it's not accelerating. India is unfortunately still on that acceleration curve, which is a problem because they have a very large population. The interesting thing is that they have a low mortality rate, but they have a very high case rate. Let's learn some lessons from what happened in Asia. In South Korea, how did they succeed at controlling the outbreak? You can see they had this huge outbreak in March, and then it really slowed down, and they've been able to stop the second wave to take off. And what they did is that they have this SWAT team of 6 to 8 people, and they do a thorough epidemiology investigation. So they do a blitz, and they basically go after people. They find out all their contacts, where they were, and they have all these investigators that go identify who people have been exposed, and they force them to go into quarantine. And they look at surveillance camera in the street and credit card transaction, mobile phone. I mean, they have a system in place, so they literally act upon it extremely fast. It's also a culture that's comfortable with giving up some of their privacy rights for the wider public interest. And as a result of that, this SWAT team descend on the place as soon as a high-risk location like a building or a public area there that got contaminated. And you can see people have a QR code that you have to use to get in and out of building. And that's some of the way you can control people who may be on quarantine. Europe, as you can see, the restriction did work. We see that there's a spike going on in Spain as well as in Belgium. Unfortunately, there and a tiny bit of a pop also in France and other countries, but nothing as compared to where they came from at the beginning of the epidemics. If we compare Europe to the US, in Europe, pretty much when they decide to do the shelter in place, 95% of people were compliant. Compared to the US, where roughly half the country did a shelter in place, or at least were compliant in following the rules. There was a coordinated federal action, but also between European governments. As you know, in the US, we're much more decentralized at the state or even on the county level within the state. The death rate in Europe was 180,000. We're at 152. We're clearly going to pass 180,000 because of the growth we have right now. The new Delhi case is 26,000 for the EU, and we are at 70,000 roughly. And the price that they pay was a bigger drop in GDP that just got announced today. In the second quarter, you can see a country like Spain dropped by 18% in 1 quarter. I mean, if you annualize that, that's a massive number. It's bigger than the biggest recession in the 30s there. And Germany was 10%. They did better than the rest of Europe, but you can see there's a massive number. The US did have a drop of 9.5%, but because we didn't really fully shut down the economy like Europeans did, it was a lower drop. We're still in the first big wave. We still haven't controlled that. We have 4% of the worldwide population, but we have 26% of the worldwide cases, 22% of the deaths, around 1,000 per day. And 56,000 people are in the hospitals right now being treated. And that doesn't count probably 4 times more people there who have the cases at home. So to keep an eye on, there is a rebound in Europe as they open the school and as they try to reopen the economy. They have a bit of a wave, and you can see that Spain, in particular, there has had a pretty big increase, roughly 4 times since they try to reopen the economy. France has a 50% increase. Germany has a couple of outbreaks they're trying to control, and Austria there. But it's everywhere. Belgium, for example, announced more restriction. You can only see 5 people per week outside your family, at least a direct family. And then Hong Kong and Japan have a bit of an outbreak. Their definition of outbreak is a few hundred cases per day, as opposed to what we have, which is 70,000. So you can see that, in the number of cases here, there is a bit of a heat up. But compared to the US, which is doing a 1,000 deaths per day, it's just it's like a different planet. So let's do a deeper dive on the US. As we mentioned earlier, we had this massive drop of the economy, which is on an annualized basis is a third of the economy. We shrank. Now there's a hope, of course, that we're going to rebound in the third and fourth quarter, but that's assuming we've controlled the virus, which I think right now we cannot claim that. So it's the biggest decline in the government data history since we've been tracking data. So we're into uncharted territory there, and of course that drives a lot of unemployment. Initially, the unemployment was temporary, but now it's becoming permanent as people are doing permanent layoff. The death toll is probably 1 person per minute. I'm just repeating that, 1 per minute. That's a stunning number. And of course, California has hit the single day highest amount of deaths per day, and so is Florida, North Carolina, and Idaho. Congress was trying to develop another bill to support the unemployment, but they have hit a negotiation issue there. So people are running out of support for unemployment. So that's going to give probably another impact on the economy as well as the layoff. And then we try to adapt to the new world. So the NBA, as you probably know, is having their competition there in the Disney World Hotel, and they're kind of protected from the rest of the world, and they get daily tested on the point of care, very fast machine. And this is interesting. 20% of adults in the US have relocated. And they've relocated because as we now work in this virtual economy there is no reason to pay high rent in a major city like this is San Francisco. 3% of the US population has permanently moved. 6% of people have moved with their family to basically get support, maybe with the children's or consolidate family households into one location there. And this is astonishing. 37% of 18 to 29 years old have moved. And they may have moved because the college is closed, they've lost their job and all of that. So we're really restructuring the way we live. And these are probably going to get some permanent change as we move forward. There are some concern about the US data. If you remember, starting in July, HHS, under the direction of the White House, forced all the hospitals in the country, 6,000 hospitals, and I think it's around 250,000 entities there with the clinics and outpatient, everything else, to report directly all their information about COVID directly to a new company called Teletracking that got a contract from HHS to consolidate just the COVID data. So the hospitals still have to give the information on anything else to the CDC. And the concern is the concern about transparency and access to data. A lot of this data is not just putting into a database. It has to be clean, it has to be validated. You have to make sure it's orange to orange and apple to apple as opposed to what may be just a mishmash. There's also concern that the hospitals were only given a few days to do this. And so I'm sure there's going to be some transitional issue. It's a brand new software. In my experience with software, things always go wrong and they don't go right the first time. And there's been a lot of delay, and they have to enter more than 120 elements all manually. This has all to be keyed in manually. This is not automated. And the reason why it's a concern is this really interesting video. And for people interested, this is a YouTube video, like 20 or 30 minutes that kind of explain the analysis. And what he says, this is the growth rate that we had in new daily confirmed cases when it was handled by the CDC. This was the change, which was around July 15. And this is what happened to the curve. But then he split that between what he called the blue state, which were mostly Democratic state, versus the red state. And this is where it's bizarre. The blue state is pretty steady-heady. The slope doesn't change much. You can see it's pretty consistent. And the red state basically go from a pretty high slope of 6.8 to a negative slope at just that inflection point when they reported data. So I'm just reporting this. I'm not making a judgment either way. I think it's something that needs to be investigated. Now, we may have had a miracle and overnight there was a change in those states, but I'm not aware of a major event like a massive shutdown of several of those states to have such a drastic impact on the slope. So hopefully it's data that was not reported right or the quality wasn't done right. I hope it's not changing the data, but we need to be a little bit careful in drawing conclusion to make sure this data here is reliable because we've only done this for not 2 weeks. So let's look at the number with that context. Overall, we're 4.5 million cases. We're growing at 500,000 cases per week. And you can see that curve and then suddenly that plateau. And let's do a bit deeper dive everywhere. Florida, Texas, California, these are like the biggest driver there, but all have that curve. I mean, except California, which is slowing down, but not the same rate that Florida and Texas. Again, using that data, if you do comparison of a period of 2 weeks, you can see that we are improving. It does show a little bit of an improvement there. You can start to see some of the green color if you look at the number of cases per day. And California was going up and now it's going down. New Jersey, unfortunately, has a bit of a spike. So it's not a huge spike. It's 440 cases, but it's still going the wrong direction. But overall, I mean, the dashboard is lighter than it was a couple of weeks ago. So hopefully the data is reliable. So you can see the plateau. You can see the increase in mortality, which makes sense because it's basically 3 to 4 weeks after that spike. So over the next 3 to 4 weeks, we're going to see this continue to go up because of that increased number of cases. I compare the hotspots and they look pretty much the same. You visually, this is the graphic from a week ago, so no major change there. If you look at the lower weekly state rise per state, so this is in yellow is the state where the cases have risen for 2 weeks. It's an improvement. A lot of the states a week and 2 weeks ago were all in yellow, especially that southwest area there. So we see some improvement, but look, it could just be data reporting because it's hard to believe that there's this huge spike and all of them suddenly all stop. As a result, the state RO is improving. You compare this to last week. And I want to remind you what we discussed last week, which is the biggest impact to change the transmission rate. So the RNO is for every person that's infected, it will infect 3.3 people. That's kind of what this number is. And we can drop this drastically by just wearing masks. And so please encourage people to wear masks because we have to get the RNO below 1 to stop the pandemic to spread. As a result of the new data there, you can see that we went from a low positive rate of 4.7%. We still continue to increase the testing. And the positive rate has gone from 8.6 last week to 7.8%. But again, it's using that same database that hasn't been fully validated yet. So testing is improving. We went from below the 35% threshold to 41% necessary level. So there's now more states, especially in that northeast corridor there, that's really control the virus, that are doing testing to control it. So we want to see that. But the rest of the country is still below where it should be. Arizona is on the scale of 0 to 100, is still at 13% versus being at 100%, which is what target is. So we're still not doing enough cases. And that shows with the positive rate, that's why you can see positive rate of 23% means these are the people we're testing that are usually in the hospitals with some serious symptoms. So Mississippi, all of those cases there, you can see very high positive rate. So clearly there's a direct relationship between the high positive rate and not enough testing. Looking on a state-by-state basis there, the good news, you can see a lot of the states seems to be stabilizing. That's kind of that blue color there. California, we're going to see is going down a little bit there. Not a lot, but going down. The hospitalization rate, is leveling also a little bit there. Texas looks to be improving from 16 to 13%. Again, we have to see if the data continues. And then New York is still doing great. So is New Jersey. Also, they have a recent spike, but it's only 400 cases. And then Florida, unfortunately, is having a lot of capacity issue there in the hospital setting. Pennsylvania has a second spike that's coming up there. If we look at states like Georgia and Washington, still on the upswing. So is North Carolina, Virginia, Maryland, and Colorado. These are all states that they haven't controlled the pandemic. Let's look at California. We have now had a spike in mortality. which is probably the delay, as I mentioned, of 3 to 4 weeks after we've had that spike. So that's very consistent there. We have had a daily death of, we have not total death of 9,000 people out of roughly 500,000 cases. And most of it is Southern California. The one thing that's happening is as we in the Central Valley, we're picking up the crops. You can see the whole Central Valley is flaring up. And so San Francisco and the North Bay is in good shape, but clearly we're having a lot of issues, especially close to the Mexican border. The Latino population is really having a high amount of cases, and that's nothing to do with ethnicity. Is the social demographics, where they live in higher density housing and they have to work outside and therefore have a high chance to be exposed. And this is a new graphic there that shows in California a good 40 to 45% of the deaths are in nursing home, and we don't really talk enough about that to make sure we protect that population. The positive rate in California has gone from 7.5 to 7.2%, so it's a bit of an improvement there. But as you will see, ICU is going up, which is probably tied to the mortality rate. And so that's not something we want to see. The good news, we have a lot of capacity in California, and so we don't have an issue there like other states. A quick summary of the difference. If you look at Imperial, which is close to San Diego and the Mexican border, they have a case rate that's 10 times higher than Santa Clara, which is over here, which is around 495 per 100,000 versus 4,900 there. So California is really an issue in the whole southern part, and the whole northern area is doing pretty well. Yes, we have some increase in the San Francisco Bay Area, but it's nothing compared to the Los Angeles area. So a further analysis of California, you can see that the young are the ones spreading it. Between 18 to 49 years old, they have a disproportionate higher number of positive cases, but the mortality is for the elderly. And so I think people need to understand that when they become contagious, yes, they may not die, but we're going to see in a second video, they may have long-term effects. But they're really helping spread the virus to people who have much higher risk of mortality. If we look at the Latino population, they are 39% of the California population, but they're 56% of the cases and 46% of the death. And so interestingly enough, the white population is 70% of the cases, but 30% of the death. So we have a lower incidence of cases, but a higher mortality. And that may be due to the age demographics. So Black and Latinos, if you look at the elderly population between 65 to 79 years old, there's a big difference in the mortality rate versus the white population. It's 48% versus 21%. So they have a much higher death rate for the older population than the white. It could be due to pre-existing condition, comorbidity, and all of that, or they just delay getting treatment. And by that time, they may have serious more complications there. So these are all areas we need to be much more proactive at testing the whole population and intervening earlier. So I want to thank you for listening to this first video. I tried to keep it short this week. And epidemiology, I highly recommend you listen to the second video called Clinical, because we have a lot of new information.